A very warm welcome to another exciting edition of your favorite program, Health Affair on AIT. On the program, we'll focus on critical public health challenges, issues of women and children with a view to finding lasting solutions. My name is Oshuomowa Daniels, your host. Today, we shall be focusing on oral health care and its importance to general well-being. But before then, let's take it to our news segment.
The COVID-19 Solidarity Response Fund has raised more than $242 million from more than 661,000 individuals, corporations, and other organizations to support WHO and partners. The fund helps WHO to deploy life-saving supplies, information and research to countries across the globe. Part of the funds have been used to provide millions of frontline workers with critical personal protective equipment, medical supplies, and testing kits to manage misinformation and infodemic. It has also helped to accelerate the research on vaccines, tests, and treatments. 1 year ago, WHO created the COVID-19 Solidarity Response Fund to respond to the outbreak of the COVID-19 pandemic. The Commissioner for Health, Professor Akin Abayomi, was the first person to take a jab of the AstraZeneca COVID-19 vaccine in Lagos.
You can see I've received my first vaccination. It was essentially painless. I don't feel anything. I'm standing. I feel okay. May I have my certificate?
Governor Babajide Sanwo-Olu and his deputy, Obafemi Hamzat, took turns to be vaccinated subsequently. Against the backdrop of some negative reports circulating in the social media about the vaccines, the governor of Lagos State and representative of the World Health Organization said such rumors were unfounded.
Testing for ourselves, for our nation, right? And we just want to encourage every of our workers, that will be called upon, especially the front line health workers, to come forward and get their vaccination, so that we can put this behind us very, very soon.
The vaccine that is coming to Nigeria has been endorsed by WHO for emergency use. It has been proven safe and effective.
Any vaccine available now that has gone through the trials, that has about 60-65% efficacy, is better than nothing. Also, again, if you've had the infection before, and with this again, it's positive for you. Like all the vaccines, a lot are still unknown about them too, especially how long they last, what kind of lasting immunity they provide. But from all studies, by WHO, the companies and everything, this is one of the vaccines that have been found to be efficacious. And I don't see any reason why we should not. Because the more we delay, we don't know what will come next because of new variants coming.
Lagos State got about 507,000 doses of the vaccines, which will be given in batches, starting with health workers. Pregnant women and children under 18 years of age are not to take part in the vaccination. In line with the National Agency for Food and Drug Administration and Control strategy aimed at eradicating fake drugs and other spurious regulated products from circulation in the country, the agency has destroyed counterfeit drugs, vaccines, cosmetics, and expired food items worth over 2 billion naira. The Director General of NAFDAC, Professor Mojisola Adeyeye, who supervised the exercise, said the destruction was part of the efforts to rid Nigerian markets of unwholesome products and engender public confidence, describing diversion and falsification of medicines and vaccines as dangerous to humans. She warned Nigerians to be vigilant and expose anyone who might want to divert COVID-19 vaccines donated by the international donors for profiteering purpose. The NAFDAC DG also promised that the agency will ensure manufacturing, distribution, sale and use of medicines and food are effectively controlled to ensure that the prescribed standards are met. 7 to 13th March 2021 was World Glaucoma Week with the theme, "The World is Bright, Save Your Sight." It highlights the need for regular eye testing for early detection, which is key to preventing glaucoma. Glaucoma is the name for a group of eye conditions which damages the optic nerves, resulting to irreversible blindness. Based on growing and aging population, the level of glaucoma is expected to rise globally.
People should decide whether they want the vaccine or not. And those who refuse to take the vaccine should not be profiled or labeled or denied any of their rights as enshrined in the Constitution. There are insinuations that those who refuse to accept the vaccine will be stopped from traveling. Before you can enter an airplane, you have to show a certificate that you have been vaccinated. In our opinion, this is an infringement of the God-given right of people. Government did not give this right, and the government cannot take away the rights. These are rights that we are born with. The right to choose what we want. The right to decide what we want. We care for the life of Nigerians, and we don't want something that they will take today. After 3 years or 5 years, we begin to hear stories again.
For this group of concerned lawyers from Equity International, the vaccine should go through clinical testing and human testing, which should take not less than 2 years before being administered. They gave an example of thalidomide drug, which was introduced and administered in 1954 in the Western world, mostly used for the prevention of early pregnancy, but was discovered after 5 years to disfigure babies.
The necessary trials have not been done, and that is why some of these companies, are issuing disclaimers that should anything go wrong, they will not be held liable legally. So we are calling on the government to suspend the use of these vaccines. After all, the disease itself is curable. So while we continue to use the available cure we have, we'll wait until we are sure that vaccines that are safe for use is produced.
The activists also kicked against the prolonged use of nose masks, which has been medically proven to have side effects on people.
It has been proven that the use of nose masks could lead to hypoxia. Just a few weeks ago, I lost a close relative of mine to hypoxia. He traveled from Lagos to the United States and was compelled to use a nose mask. He got down from the plane and he collapsed, and that was the end. When you exhale, when you inhale oxygen, you exhale carbon dioxide. Now, when you use the nose mask, your carbon dioxide is trapped right there. And so the continued inhaling of the carbon dioxide that you're supposed to be giving out, which is supposed to circulate out, is definitely injurious to health.
They appeal to the governments not to make the COVID-19 vaccination mandatory if they must continue with it.
Welcome back. Information provided by some oral health care experts indicate that a large percentage of the world's population, especially Nigerians, will suffer from preventable oral diseases in their lifetime if adequate measures are not taken. To reduce the burden of these diseases, I spoke with a consultant family dentist, Dr. Victor Decay. Dr. Decay is also the Vice President of Nigerian Dental Association. He will be telling us about the challenges of oral health care in Nigeria, how to care for the mouth, and lots of other relevant things you need to know about oral health care. The topic is coming at a very crucial time when we are about to celebrate the World Oral Health Day 2021.
Oral health is that state of health that the mouth and all the associated structures like the tongue, the lips, the gum, the tonsils, even the floor of the mouth, the mucosa. Generally, all associated structures are in good condition such that you can perform the function with your mouth or the functions required of your mouth without any stress or inhibition. So that ideal state of health of the oral environment where you can perform the required functions like chewing, talking, kissing, laughing, any function you are meant to carry out with your mouth when it is done without inhibition, that represents an ideal state of oral health. So it's very important that every human being considers the mouth as priority and taking care of it.
Now, How would you how would you rate the attitude of Nigerians as regards their oral health care?
Well, there are a lot of factors that may be responsible to what I would call the very poor attitude of Nigerians to issues concerning oral health. You know, you can't blame people. There are a lot of competing demands. People have not even had enough to eat, to do the basic things, then they are even contemplating oral health issues. And you know, the thing about oral health conditions, they start very slowly. They may not hit the patient hard immediately. Like for instance, if what we call tooth decay, that dental caries, could start as a small discoloration. We call it white spots. You can see an area, a portion on your enamel, that's the outer corner of the tooth. There's a spot, and that spot you saw there is a product of demineralization, the loss of mineral that strengthens the enamel as a result of acids in the mouth. That spot, if left unchecked, will progress to cavitation, and it will take an average of about 3 years, if not more, for that cavity from that spot lesion level to get to frank cavitation into the dentin. So you can see the time it takes. So patients may not consider it a priority because they have limited resources and they have huge demands in terms of their daily need. So people generally have poor attitude to it. I'm not holding brief for anybody who does that, but that is why we are doing this. That people should be aware that you don't have to wait for your conditions to get to that chronic stage, you know, or life-threatening stage before you take care of it. You understand? Generally, the attitude of Nigerians are very poor to oral health issues. Some of them resort to self-medication. They do all manner of unthinkable things, all in a bid to get relief from oral health, not knowing that they are even causing more damage or harm to themselves by such harmful practices.
So what are some of the common oral problems that will come down with or be present with at the hospital?
The commonest one, if you ask me, is tooth decay, which we call dental caries. I think it is said to be the commonest disease afflicting man. The next one is gum disease, and in gum disease there are 2 legs of it. The initial stage is called gingivitis. It can progress to periodontitis, and then you can have things like halitosis, which we refer to as mouth odor. There are oral ulcers. You have cancers. You even have cystic formation. There are several conditions that affect human beings. There are even some other oral medicine conditions like xerostomia. There is even this loss of taste and smell, you know, and other related conditions really that could afflict one in the mouth. So many. There are so many. Oral cancers are there, and the commonest when you talk about the oral environment is called squamous cell carcinoma. And it has the same, if not similar, predisposing factor like other cancers in the body: smoking, alcohol, and the likes.
So for general care of the mouth, what would you advise people to do to care for their mouth?
Well, to care for the mouth, you start by identifying what the problems are. Because if you, like we talked about tooth decay, for instance, you need to know what are those factors that are responsible for the initiation of that decay process. When you are aware of these causes, then it becomes easy for you to take care of them. You have to brush morning and the last thing before you go to bed. And then not just brushing, you have to brush using the right technique, using the right strength of toothbrush. What could I use your medium or soft? And then you have to brush within the right duration, and then your toothbrush you have to change at least on the average after about 3 months on when the bristles begin to fray. So those are, once you do that, you've taken care of another aspect in reducing the bacteria load in your mouth. And then there's also this professional cleaning, which is called scaling and polishing, that we encourage people to do. It's very important that you do that. because they are very difficult or hard to reach areas in your mouth that your toothbrush cannot get to. That way, in the clinic, a dental professional referred to as therapist can help you professionally clean those difficult to reach areas and remove or at least reduce the load of bacteria in your mouth. They will encourage, apart from brushing, you should use dental floss. It's very important that you floss in between your teeth too. Understand? So that again will help.
Now, what can government do to improve access to oral health care?
Awareness is still very poor. Government should encourage the dental profession by ensuring that the oral health policy that was passed some years ago is fully implemented, so that every nook and cranny of this country will have a dental facility. We'll have about 774 local governments, I'm sure. There's nothing wrong in government having a standard dental facility in all the council areas to ensure that people access dental care. And then there's also aspect of dentistry that common among pregnant women. There are diseases that are associated with pregnancy. They that come for antenatal care can also benefit from dental care, even at that local level. So government should invest massively, to take deliberate steps to improve oral health awareness. There could also be tax rebates or complete exemption for dental materials, because they are very expensive. A lot of them are imported, So build more dental facilities, create awareness, sponsor programs, partner with the association of professionals in that area so that awareness can be created. A lot of people, even some who have the means to access health care, oral care, don't even know what to do. A lot of them are aware. You see big directors. I've gone to places, when I see big people and I look into their mouth, I'm like, this person, money is not your problem. But they don't know what to do. Not many people are aware that they need to even go to the dentist to go and do scaling and polishing, which is washing of the teeth. So a lot of people are just, their problem is ignorance. So government should rev up advocacy. Let there be enough enlightenment for people. Let those at the helm of affairs, the policymakers, show some interest in dentistry and oral health, so that people will be aware. Improve infrastructure, check, lack of knowledge. Poverty is there. Maybe you should just work on improving the pockets of Nigerians by paying more. I hear they're demonstrating for minimum wage. You want to tell those ones to come and do oral health procedure, and it's very expensive. Then the insurance, this NHIS insurance scheme should incorporate dentistry, as a primary care provider. That way people can access it, and then it will go a long way in helping people to enjoy better health. So there's nothing like complete, total, perfect health of the body if you don't consider oral health a priority. Then the insurance, this NHIS insurance scheme should incorporate dentistry, as a primary care provider. That way people can access it, and then it will go a long way in helping people to enjoy better health.
Thank you very much for coming on the show. We appreciate you. Next on the show is our nutrition segment, and the focus for today is on snail.
Called garden pests are often found in green surroundings or along the sea. Snails constitute a major ingredient in most cuisines in many countries of the world. Snails have been in existence ever since the Roman era. They were picked up and fattened in small gardens until they reached a stage suitable for consumption. In the beginning of the Middle Ages, snails enjoyed the advantage of being considered neither fish nor meat, hence making them ideal food to be consumed during Lent. Snails are a great source of lectin, possesses anti-cancer properties, and helps in boosting the immune system. Snails are rich in collagen and elastin, which is beneficial for the treatment of skin diseases and broken bones. The venom extracted from the ocean snail is highly beneficial for people suffering from addictions, depression, and Parkinson's disease. Snail contains protein, 16.1 grams, water, 79.2 grams, carbohydrate, 2 grams, cholesterol, 50 milligrams, fat, 1.4 grams, omega-3 fatty acids, 218 milligrams, calcium, 10 milligram, iron, 3.5 milligram, phosphorus, 272 milligrams. The nutritional facts about snails could go on and on. Consumption of snails also helps in the brain and memory development of children, prevent heart diseases, lowers high cholesterol levels, and excellent for healthy fetus.
On Know Your Medical Instruments segment, we shall be telling you about the bandage and its uses.
A bandage is a piece of material used either to support a medical device, such as a dressing, or on its own to provide support to restrict the movement of a part of the body. When used with a dressing, the dressing is applied directly on a wound and a bandage used to hold the dressing in place. Other bandages are used without dressing, such as elastic bandages that are used to reduce swelling or provide support to a sprained ankle. Tight bandages can be used to slow blood flow to an extremity, such as when a leg or arm is bleeding heavily. Bandages are available in a wide range of forms, from generic cloth strips to specialized shaped bandage designed for a specific limb or part of the body. Bandages can often be improvised as the situation demands, using clothing, blankets, or other materials. Different types of bandage include adhesive bandage, compression bandage, short stretch compression bandage, long stretch compression bandage, triangular bandage, and tube bandage.
Next on the show is our clinical segment where we'll give you tips for healthy living. Please come with me.
The first aid for burns is once there is a running, open the tap, running water to cool the area for about 5 to 10 minutes. Just keep cooling it immediately. An example is if you say, oh, there's fire, you are still looking for egg to pour, that hot temperature remains, and then it will be causing deeper burn injury. Unlike immediately there's burn, you put underwater and it starts cooling the temperature. That heat, instead of the contact period being very hot, being for a prolonged period, it will reduce drastically with the cooling of that part. If one is involved in a fire, and as you run, the oxygen continues to fuel the fire as you run. So to break that cycle of the oxygen fueling the fire, you stop, you drop and roll. So that will, stop the oxygen that is fueling the fire to quench the fire. Yes, so you can do that if you run. So you hear some people say, oh, as I was running, the fire was, you stop, drop and roll. That will stop the fire.
On our perception segment, everyone is invited to have a say on the way forward for the nation's health sector. To participate, you can reach us on our social media handle or call the numbers showing on your screen.
Things to work with, of basic allowances, of poor remuneration. These are things we fought over in the 90s, in the 80s. And there are still things that are still challenging the health sector today. So, to that extent, yes, one can say we have not made any appreciable progress. But if we look at in terms of numbers, then we have made some progress. We have more teaching hospitals today. We have more federal medical centers today. We have more general hospitals today that are functional. We have more of every cadre of health sector worker today. The professors, the consultants, the postgraduate students or residents, the numbers are much higher than what they were before.
This is where we draw the curtain on the show today. Please join us next week as we continue with mouth odor, causes, and solutions. My name is Oshomo Daniels, and I always like to remind you that your health is your wealth, so pay attention to it.